Hello and welcome to Healthcare IT Today, where we explore the latest news, interesting stories, and technology trends in health IT. I'm Colin Hung, and today I am joined on the program by Dr. Beth Kushner, the Chief Medical Information Officer at St. Joseph's Health System in New Jersey. I'm going to sit down with her to learn more about their implementation of computer-assisted professional coding, or CAPC. We're going to learn what it is, but more importantly, we're going to learn why this type of solution has helped St. Joseph's become more robust and better able to face these difficult financial times that we're all facing in healthcare. I'm excited for this conversation. Dr. Kushner, welcome to the program.
Thank you. Thank you so much for having me.
Now, before we dive into the questions that we have for you, can you tell us a little bit about St. Joseph's Health System and your role there?
Sure. So St. Joseph's Health System is located in northern New Jersey, geographically 12 miles outside New York City, but could take anywhere between 4 hours and 20 minutes, depending on the time of the day that you'd like to drive from New York City to Paterson, New Jersey. I would say that we're a moderate size healthcare system surrounded by huge healthcare giants, which is the New Jersey way. We have two facilities, a large academic facility, a smaller community hospital, and then a network of ambulatory offices that both have what we say private patients with commercial insurance, and we have a passion for those who are underserved. Here at St. Joe's, I work as the Chief Medical Information Officer. What that means is I'm clinically in charge of our EHR, which I'm very proud to do. But I think my true passion happens to be in the revenue cycle and the documentation world. I've been certified as a professional coder. I've gotten my CDS certification as well, along with a compliance certification. So in general, I'm very nerdy about documentation. I love seeing the rules and the regulations and how can we implement that in a technologically advanced way.
So let's dive in a little bit. I understand that you recently smartly invested in improving several of your internal processes, specifically around revenue cycle. Why was it important, or why is it important for healthcare organizations to look for efficiencies in RCM, but elsewhere as well right now in this kind of environment?
I think when you look at the landscape of healthcare dollars, we all know that there's price compression. And so the question is, what can I do better, more efficiently, more often? And when you look to see how you can inject technology into your workflow, it's important to do it in a smart and a very deliberate way. So AI technology is everyone's favorite phrase, but I don't really like artificial intelligence. I like to call it augmented intelligence. I'd like to utilize that type of behavior to take away processes and things that I don't want someone to repetitively think about. I want stuff to be able to make you more efficient. I want stuff to go on in the back end. All of these things, if you inject technology in a smart way, you can have better outcomes more efficiently with a less dollar value. So then you can re-inject that money where you actually need to be injecting it versus spending it on menial tasks.
Can you share with us specifically some of the improvements that you've made in the billing, coding, revenue cycle area?
Sure. So we've partnered up with a company called AGS to use a product called EZDI. And what that does is computer assisted coding. And when you look at coding in general, and this is the fun fact that I don't think anyone in revenue cycle truly knows, nobody in medical school ever learns what a CPT code is. Those are 3 letters that have never been uttered. Then you become a resident and you're so worried about seeing patients and learning medicine that no one talks or teaches you about billing and coding. Then all of a sudden you become an attending and all of a sudden you're supposed to run a practice. And it's really funny because no one learns about it. And so we've allowed providers to do their own billing and coding because, they're they're at the helm of the ship. But in fact, no one actually knows what they're doing. And so we have a lot of issues, and that's okay. And I don't want providers sitting there and Googling CPT codes. I want them seeing a patient. And so when we look to see how we're going to do better and provide better care, I want to use computer assisted coding to take away that burden and then allow the provider to have more time at the bedside with the patient. And when you look at the different flavors of how to assist in coding, there's, in my opinion, three flavors. You pay for a coder to do the work, and that's very, very, very expensive. Takes a lot of human effort. You have to train the person. You have to get enough coders to help you. It's fairly robust to actually have a coding team. The next flavor would be computer assisted coding. So you have a computer plus a human. And the last is fully automated. I would say that most doctors are skeptics, myself included, to fully automate coding is a little scary to go from I'm in control to a computer's doing it. And will the computer understand my notes? Do they understand the complexity? So that I also don't think is the best choice currently. Instead, we partnered up with AGS to use EasyDI to have computer-assisted coding, to have a computer aid a human coder to be quicker, faster, and to be able to process our charts and our CPT codes in a faster and more reliable way.
So, for the benefit of our audience, if I was a coder on your team and I had the computer assisted professional coding solution running, what would I see as the coder that's different than my regular day to day?
Sure. So if you're a day-to-day coder, you get a chart, you look at the chart, and then you're going to write your ICD-10 codes, your CPT-2 codes, your HCPCS codes, and then you're going to choose your E&M level. Let's say it's an office visit. With computer-assisted coding, it uses natural language processing to pull out and to highlight, once again, augmented intelligence, to show you these are things that I think are important. And then I, as the human, with all of the information that I have and all the intellect, I can then say, yes, I agree, or no, we kind of got it a little wrong. And then I can confirm that, yes, I in fact agree with what the computer spit out. So it's like a double check process, but it creates such a level of efficiency that helps us do the job of multiple people in an efficient manner.
And has that been the big impact of the solution from AGS? Is this more efficiency for your staff? And
So I would say we have an increase in efficiency. And the biggest thing, so for those of you who are in the RCM world, a clean claim rate is something that we highly care about. And we care about, and when I counsel physicians on this, they're like, I don't care about a clean claim. And I said, but you do, because realized revenue is incredibly important to be able to reinvest that into your healthcare system. And it's the realized revenue that I care about. So through the course of implementing this project, we've noticed an increase in our clean claim rate, which in turn you can extrapolate to getting money back into the system for services that we've already rendered. And that way we can reinvest it in our patient population.
I really want to key in on that because what it sounds like is this is not a solution that you implemented because you were looking to cut your staff in half. That wasn't sort of the goal. The goal was this clean claims, getting the revenue in that you should be getting the first time and more quickly.
Exactly. I want to emphasize that technically I didn't pay for coders beforehand. What I did is I ended up taking what we could say is a free resource because it's the doctor, and now I'm paying for coding. The benefit that I'm getting is that when I put in a code, now I will end up getting that revenue back quicker and more reliable. I've already paid for all of the other things. I paid for the office, I paid for the doctor, I paid for the nurse. We've already put money out, so let's get that money back in. And that is an important emphasis to me, is we're not cutting jobs. We're able to actually become more robust based on utilizing these tools.
And what's the staff's reaction been to the computer assisted professional coding product?
Most doctors are skeptical. Very few are like, yes, I love it. However, once we show them proof of concept and show them the way that the technology works, they're like, great, I don't want to do this anymore. I don't want to be a coder. I don't actually understand what a CPT code is. And truthfully, I don't want to. And when I'm able to give time back to providers, they're so grateful because a provider became a doctor to see patients, not to sit there and to Google stuff. And so I want to bring them away from their computer and back to seeing patients.
And when you implemented CAPC, did you have to make a lot of changes to the way you were doing coding? Were there a lot of workflow changes that you have to implement alongside of this type of technology?
I wouldn't say there's been a lot of workflow changes we had to do. I think we beneficially got to see our workflows and we got to kind of scrutinize what we're doing. And what we found is some things that we thought were efficient were in fact not efficient at all. And there were some things where we had things that weren't the same amongst our many practices. And so when you do a deep dive with technology, you have to know your workflow beforehand. And it's critical and it's key for successful implementation. And so we went to some practices and I said, just tell me what you do. And then we realized, oh, well, this is a very 2002 workflow. Why aren't we leveraging this? And they're like, I had no idea. So it's actually a twofold benefit where we got to actually optimize the things that we were already doing, but in no way did we have to break a current workflow to make it work with the product.
And when you saw this type of solution, what was it that really attracted you? Was it truly the simplicity of it? Was it the potential robustness gains? Like, what was it that really finally lit that light bulb for you that said, I really need to get that in here?
So I like the fact that it's a combination of technology and human input. I think medicine is one of the rare fields that you just can't make it automated. There is not a single patient that has ever followed any textbook that has ever existed. And I think that that's an important thing to note for healthcare. And it's something that other industries don't quite understand. Banking is banking. Money flows in, money flows out. Healthcare is unique and we're robust and we're different and we have weird regulations and we have different payers and it is a totally different beast than other industries. And so what really attracted me to this product itself was the partnership that AGS said that they would give us, and they've proven over and over again that this is a partnership. The ability to create new algorithms in the product itself, the ability to enhance it, and not necessarily right from the beginning, you get good at one thing and then you can layer on the things that you want your system to do. But at the end, there is still a human who's verifying like, yep, this is like, yep, we're going to check this. It's the eyeball check. When I eye this, does it look right? And I think that that is an undervalued thing in healthcare. And it's still incredibly important for what we do.
What advice would you give to someone who's listening or watching this who may be looking at CAPC or, like you said, maybe skeptical about CAPC? What would you tell them and what advice would you give them?
I would say that, so if you're skeptical of CAPC, what I would say was seeing is believing. And so sit down, see a bunch of vendors, sit down and take a look at the product, have them run your current information and see what happens. And the advice that I would give other people is an algorithm is going to be 70 to 80% successful. That's kind of what we're looking at. And that's okay. I like that. That means that I can be 70 to 80% more efficient based on the fact that a computer is offloading those issues. And now for those 20% of weird, nuanced, complicated, complex things, now a human can now spend their brain power on those 20% versus on the 100% of the body of work. And so when you start to reframe, we're not taking away jobs. I don't want to take away a human coder. I want to make your job easier and save your brain power for something that's incredibly important.
Dr. Kushner, you've shared a ton of great information. Thank you so much for being on the program. But before we go, where can people go to learn more about St. Joseph?
So we have a wonderful website. You can go on the internet, St. Joseph's Health. .org. We're located in northern New Jersey, so there's a lot of St. Joseph's out there. So pick ours, not any of the other St. Joseph's. We're the best one. We really value our mission, our purpose. We are here for the underserved population, and I think that you can see that as we do various different projects, and how we inject that into the world of RCM is always interesting because it's revenue, but we're here to serve all of our population. So we always welcome any inquiries, and if anyone ever wanted to reach out, please find me on LinkedIn. I'm happy to talk about various items. I love RCM, documentation, technology, so I always welcome all inquiries.
Well, Dr. Kushner, thank you again for your time, and thank you for providing all this great back-end information around a process that, let's be honest, doesn't get as much attention as it deserves. So really appreciate you coming on the program today.
Thanks so much for having me. I appreciate it.
Hey, I really want to thank Dr. Beth Kushner for coming on camera with me and giving us that really insightful view into computer-assisted professional coding. I definitely loved how she emphasized that implementing this type of solution is not about reducing headcount, and it's actually more about accelerating revenue that they should have been earning and having that clean claims rate. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com, where you'll find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.